Hi guys, welcome to Pathopals_Radhika. So hope you enjoyed the video on series of genes related to neoplasia for the past few days. So I'm very happy to have we are going to reach around 500 subscribers for our channel. So now I'm going to stop with the discussion of genes related to neoplasia. And most of the important genes I've covered over the videos in the past few days. So from today onwards, for the next few subsequent days, as requested by few of our subscribers, I'll be discussing on the previous year MCQs. Okay. So if at all you want any particular topic to be discussed, you can post in the comments. So this was a question from the recent INICET exam which was conducted recently. So the question is, which of the following condition will have least chance of dry tap on bone marrow aspiration? So the options are hairy cell leukemia, follicular lymphoma, AML M7, aplastic anemia. So now read the question carefully. So try to spend some time on the MCQ. Read the question carefully, or else you know the concept, but you might answer it wrong sometimes if you're not reading the question correctly. So now see here, you have a dry tap, but the question is about less chance. So it's a question where they ask which is not associated with dry tap or less chances of being associated with dry tap. So I've already put up a video on what is dry tap. So those who have not watched, you can just watch that video as well. So now we look at what is dry tap, then we'll go into discussion. So what do you mean by dry tap? So for this, you have to understand something about your bone marrow and the architecture of your bone marrow, right? So what you need to understand in bone marrow. So look at this image. So when you are going to take a bone marrow biopsy, you take a core of a bone from your iliac crest. Usually that's the usual site in adults. Sometimes sternum and sometimes tibia as well. Okay. So when you get take a piece of bone, a core of bone, okay, what all you get? So sometimes you can get the cartilage. Then all these pink stuff, what you have is the bone. So this particular thing, it's all trabeculae of bone. Trabeculae is a pattern. So you have some pieces of bone like a trabeculae. So this is trabeculae of bone. So in between you have these intertrabecular space between trabeculae of bone. So here you are able to see some light areas and some dark areas. So all these light areas are nothing but your adipocytes, your fat. So your bone marrow consists of your hematopoietic cells and fat. Okay, adipose tissue. So all these empty spaces are fat, and whatever you are seeing it in blue, they are hematopoietic cells. So the area which is near the bone marrow surrounding the bony trabeculae, we call it this paratrabecular. Para means adjacent, trabecular means adjacent to trabeculae of bone. So you need to understand there is something called paratrabecular surrounding the bone. So why I'm using this is because I'll be discussing it in the later part of the video. So as of now, just know this: when you're going to take a bone marrow biopsy, you take a core of a bone in which you see trabeculae of bone and intertrabecular space, and in intertrabecular space you have your bone marrow, which is composed of your hematopoietic cells and adipose tissue. So the amount of adipose tissue and your hematopoietic cells varies with the age and with the pathology, and the area surrounding the trabeculae of bone, we call it as a paratrabecular area, right? So this is how a normal bone marrow architecture is designed. So next, you have certain locations where it's just a hyper view to show your adipocytes and your hematopoietic cells. It's just a hyper view. Okay. So next is the options which you had for dry tap was, the first option was hairy cell leukemia. So what is hairy cell leukemia? It's a B cell non-Hodgkin's lymphoma. Remember, it's a misnomer. It's not a leukemia. It's a B cell non-Hodgkin lymphoma. Okay. So you can have hairy cells in the peripheral smear, but what do you have in a bone marrow? So what happens? One property of this hairy cell leukemia, they produce certain factors, certain growth factors, which can lead to fibrosis of the bone marrow. Okay, so your bone marrow will be fibrous. So I was telling about the intertrabecular space, which had lot of hematopoietic cells and your adipose tissue. So imagine this is fibrosed and you're just going to pass a needle and take a bone marrow aspirate or a bone marrow biopsy. What happens? Because of the fibrosis, you will not be able to aspirate any material. So this is dry tap. So any condition in which your bone marrow is fibrosed, or sometimes you can have a very hypercellular marrow which is tightly packed. For example, in acute leukemia sometimes, okay, when it's tightly packed, okay, so you will not be able to aspirate the cells when you're doing the procedure. So that leads to a dry tap. It's not a technical fault, it's basically the pathology in the bone marrow which is going to cause a dry tap. Even if you're going to repeat, you're going to get a dry tap. So dry tap may be associated with certain conditions. So what are the conditions? Whenever you have fibrosis or your bone marrow is tightly packed, you can get a dry tap. So in hairy cell leukemia, you have certain growth factors which can cause fibrosis of the marrow. So hairy cell leukemia can cause bone marrow fibrosis. So having discussed hairy cell leukemia, remember an extra point. So the cells will have lot of cytoplasm which are separated by some space. So this leads to a fried egg appearance, and remember hairy cell leukemia can be associated with BRAF mutations. Okay, so you can post in the comments what are the other malignancies associated with BRAF mutation, which again I have discussed twice, I guess. Okay, so tell me in the comments what are the other conditions associated with BRAF mutations. So tomorrow I'll update what are the other conditions associated with BRAF mutation. So are you clear now why hairy cell leukemia is going to cause a dry tap? Right? So we are going to the next option, follicular lymphoma. So what is follicular lymphoma? So follicular lymphoma is a type of B cell non-Hodgkin lymphoma. It can involve the bone marrow. So remember, bone marrow biopsies are done for staging purpose when we diagnose certain lymphomas. Okay, so usually this can involve the lymph node, but you do a bilateral bone marrow biopsies to assess whether your bone marrow is involved or not. So in that case, what happens? So follicular lymphoma can have a characteristic appearance in the bone marrow. What happens? They tend to localize near the bony trabeculae. So that's why I was telling about paratrabecular. So whenever you see a paratrabecular lymphoid aggregate in a bone marrow, it's usually alerts to some abnormality, and mostly this particular pattern is associated with follicular lymphoma. It can be other atypical lymphoid infiltrates as well, but remember whenever you see a paratrabecular lymphoid aggregate, that means lymphoid aggregate surrounding a bony trabeculae, always think of follicular lymphoma, try to rule out that. So this you should never forget, paratrabecular involvement of the bone marrow by atypical lymphoid cells is seen in follicular lymphoma. Here you don't get a dry tap because it's only a part of a marrow which is going to be involved, right? So next option was AML M7. So anyone, what is AML M7? What's the name of the leukemia? It's a myeloid leukemia. It's an acute megakaryoblast leukemia. Okay. So in AML, you have different types. AML M0, M1, M2, M3 like that, depending upon the differentiation. So AML M3 is acute promyelocytic leukemia, right? So APML. AML M7 is acute megakaryoblast leukemia. So like hairy cell leukemia, these can also lead to fibrosis of the marrow. So remember, AML M7 is always important. M7 is very, very important. Why? Because you can be associated with Down syndrome. Okay, point number 1. It can be associated with Down syndrome. Point number 2, it can cause bone marrow fibrosis. Point number 3 is what you're seeing here. So definitely these are atypical cells. These are blasts. But if you want to suggest some type of AML, this blast is going to give you a clue. What is it? They have certain projections. Are you able to see these projections? So these are cytoplasmic blebs. So see here, these are pseudopods or projections or cytoplasmic blebs. So which is more commonly associated with AML M7. So they are associated with pseudopods or cytoplasmic blebs. So 3 points about AML M7. It can be associated with Down syndrome. It can cause fibrosis of bone marrow. It can have blebs or pseudopods. Now tell me whether AML M7 can cause dry tap. Yes or no? Yes. Why? Because they cause bone marrow fibrosis. So this is very important. And one more thing. So remember, Down syndrome predisposes to ALL as well. Not only myeloid leukemias, your lymphoblastic leukemias as well. Okay. So now we have discussed about hairy cell leukemia, follicular lymphoma and AML M7. Your last option was aplastic anemia. So what do you mean by aplastic anemia? It's a condition where your bone marrow is not able to produce your hematopoietic cells. Basically, in your intertrabecular space, you don't have cells, you have only fat or very less cellularity. So in that case also it will be a dry tap. So aplastic anemia can also lead to dry tap. So few extra points on aplastic anemia. So remember, always make a point to examine the spleen of a patient. So if there is splenomegaly, your diagnosis is usually not aplastic anemia. That means in aplastic anemia, you should not expect a splenomegaly. It's against the rule. So splenomegaly is not seen in aplastic anemia. So that thing you should remember. So having discussed everything, now tell me what should be the answer. So the question was, which of the following is associated with least chance of dry tap? And the option were hairy cell leukemia, follicular lymphoma, AML M7 and aplastic anemia. So now let's go one by one. So does hairy cell leukemia cause dry tap? Yes, because it leads to fibrosis. Does AML M7 cause dry tap? Yes, because it causes fibrosis. Aplastic anemia can also cause dry tap because there is no cellularity. So what should be the answer? The least chance of dry tap is associated with follicular lymphoma. You don't expect a dry tap in follicular lymphoma. And few more extra points I have told. Hairy cell leukemia can have fried egg appearance of the cells and you can have BRAF mutation. And AML M7 3 points, it can be associated with Down syndrome. So remember, not only AML, ALL can also occur in Down syndrome. Then they can have cytoplasmic blebs or pseudopods. They can cause fibrosis of the bone marrow, right? Then about aplastic anemia, if you have splenomegaly, your diagnosis is wrong. You don't expect a splenomegaly in case of aplastic anemia. And about follicular lymphoma, they cause paratrabecular lymphoid aggregate. So dry tap is a very important question. So remember, whenever you have fibrosis or a tightly packed marrow, you can have a dry tap. So this is the answer to the question. And what's your homework is to put up a comment on what all conditions can lead to BRAF mutation. I've discussed this quite a few conditions where you can have BRAF mutations. So tomorrow evening I'll put up a video or I'll just reply in the comment about the causes of BRAF mutation. Okay. So thank you so much for listening and don't forget to post in the comments about the causes for BRAF mutation. Thank you.